And the honourable member for Kelowna Lake Country.
Thank you, Mr. Speaker. It's always an honour to rise on behalf of the residents of Kelowna Lake Country. I rise today to speak about the ongoing drug addiction crisis and its terrible impacts on residents in my community of Kelowna Lake Country and across Canada. Overdoses are up, overdose deaths are up, and addictions are up. Since 2015, overdoses have increased 184%, and that is nearly 45,000 Canadians who have sadly lost their lives. The radical NDP Liberal so-called safe supply drug experiment has done nothing to stem the tide of overdose deaths. It has instead flooded our streets, playgrounds, public spaces, and even hospitals with dangerous illicit drugs. We've heard from expert witnesses that diverted so-called safe supply drugs such as hydromorphone are being resold and trafficked into our communities and used as currency in exchange for fentanyl. This fuels the drug trade even further. A report commissioned by BC's top doctor actually said that the program was, quote, almost as good as giving drug users cash. I've talked to first responders in my community who are frustratingly seeing the effects of these policies on our streets. The Vancouver Police Department noted that around 50% of all hydromorphone seizures were diverted from government taxpayer-funded drugs. Over 30 criminal charges were just made following a raid in a so-called safe consumption site in Nanaimo. We have heard that drug diversion is specifically targeting children. And we already saw what happened when the federal addictions minister previously approved of an open drug use policy in public spaces, including parks and playgrounds. Open drug use in playgrounds normalizes exposure to deadly drugs to children and was a contributing factor for this reckless policy to be backtracked when it was repeatedly called out. There was drug paraphernalia vending machine in British Columbia distributing crack pipes and syringes, only which, after massive public pressure during a provincial election, did the NDP provincial government stop it. Unfortunately, this ideology-driven minister appears to show no signs of slowing down from implementing radical policies. In July, a memo to the Minister of Addiction was obtained through an access to information request. This memo advised the government to, quote, use all tools, unquote, at its disposal to address the crisis, including using national drug decriminalization. This means the Liberal government is considering the legalization of hard drugs like crack meth and fentanyl across the whole country, and this reckless expansion cannot happen. We continue to see the disastrous results of the NDP Liberal drug policies in British Columbia. Recently, on Vancouver Island, a tribal council representing 14 First Nations declared a state of emergency over the ongoing opioid crisis. In British Columbia, drug overdoses have become the leading cause of death for children between ages 10 and 18, and this is absolutely heartbreaking. We cannot afford to continue with these Liberal policies, nor can we afford to entertain the expansion of deadly programs that are flooding our neighbourhoods with drugs. The taxpayer funding of dangerous drugs must end now, and as such, common sense Conservatives will end the failed NDP Liberal drug experiment for good. We will instead bring hope and healing through addiction treatment and recovery to bring our loved ones home. Thank you, Mr. Speaker.
The Honourable Parliamentary Secretary.
Thank you, Mr. Speaker. The toxic drug and overdose crisis continues to impact Canadians from coast to coast. People are losing their lives to the ever-changing illegal toxic drug supply, and many are dying because of it. These are preventable deaths. We need to do everything at our disposal to save lives. This crisis is complex, and we need to work together with all orders of government, partners, and stakeholders. We need to listen to our partners and do everything we can to save lives, improve access to healthcare services, and maintain safe communities. A strict law enforcement-only approach with no acknowledgement that it is a public health crisis has driven Canada's response to substance use for over a century. It has been proven time and again to be ineffective. We owe it to Canadians to work towards solutions. What Canadians suffering from addiction need is health care, not to be in jail. Mr. Speaker, this government's commitment to working with all others of government to find local solutions is unwavering. Working in partnership is what responsible governments do. Screaming slogans into the void is the only solution Conservatives offer. They like to talk about crimes and disorder, but the actual experts, law enforcement, don't agree with them. They have been clear that they support a comprehensive public health approach to addressing substance use harms. Police are looking for better ways to address community concerns around safety in public spaces rather than arresting someone for a health care issue. Cities across Canada are witnessing the compounding effects of the ongoing overdose crisis. People who are managing co-occurring mental health issues, the impacts of the housing shortage, and the need for more affordable housing. If they care so much about public drug use, they wouldn't oppose safe consumption sites, because when these sites don't exist, it's streets and our public spaces that becomes consumption spaces. Monsieur le Président, il n'existe pas de solution.
Mr. Speaker, there is no single solution to this crisis. We need innovative measures to save more lives, and we are closely reviewing what can be done to make any necessary adjustments and to ensure that Canadians can access a range of harm reduction, treatment, and prevention services, as well as the support they need when and where they need it, all while protecting communities. For example, Budget 2024 announced a commitment of $150 million for a support fund for municipalities and Indigenous communities. That funding will enable us to offer rapid response to affected communities who have urgent and critical needs having to do with the overdose crisis. That is in addition to the billions of dollars that we are already using to fight that crisis.
The honourable member for Kelowna Lake Country.
Thank you, Mr. Speaker. The numbers speak for themselves. The drug crisis has gotten worse after 9 years of radical, liberal, reckless policies, not better. Even the BC NDP requested the federal Liberal government recriminalize illicit drugs after the massive failure of their joint drug experiment. It's no wonder, given BC sadly saw a 400% increase in drug overdose deaths in the first year following the decriminalization experiment. Many of our residential neighbourhoods where children used to be able to play and seniors used to be able to walk safely, as well as business areas with small businesses, have been taken over with crime and people openly suffering from addiction. The Liberals' drug policies are not working. We need to give people hope by focusing on addiction treatment and recovery so we can bring our loved ones home.
Secretary to the Minister of Family, Children and Social Development.
Thank you, Mr. Speaker. Canada's approach to addressing the toxic drug and overdose crisis and substance use-related harms is comprehensive, equitable, collaborative, and compassionate. It is guided by the Canadian Drugs and Substances Strategy. This federal strategy outlines a continuum of care, including prevention and education, harm reduction, treatment, and recovery. Notre gouvernement soutient une approche.
Our government is supporting a public health approach that is data-centered, centered on individuals, taking trauma into account and offering safe cultural support. Our government also wishes to increase public safety. Since 2017, we have invested more than $1 billion to directly address the overdose crisis, investing in both health and public safety. That includes funding the RCMP to reduce drug-related organized crime, as well as trying to reduce the availability of these chemicals. We will do everything we can to put an end to bias and the senseless deaths of Canadians affected by this crisis while keeping communities safe. Thank you very much.